Hello and welcome. Today we're diving into the world of persistent or chronic motor or vocal tic disorder. This neurological condition, sometimes confused with Tourette's syndrome, presents its own unique set of challenges, and understanding it is the first step towards better management and support for those affected. The exact cause of persistent tic disorder remains somewhat of a mystery. Like many neurological conditions, research suggests a complex interplay of genetic predisposition and environmental factors. Studies involving families with tic disorders indicate a hereditary component, meaning genes can play a role in increasing a person's susceptibility. However, it's not a simple single-gene inheritance. Environmental factors, such as prenatal exposures or childhood illnesses, might also contribute to the development of the disorder. Although more research is needed to pinpoint specific triggers, it's important to remember that having a genetic predisposition doesn't guarantee the development of the disorder. It simply increases the likelihood. The pathophysiology, or how the disorder affects the brain, involves several key areas and neurotransmitters. Primarily, it's believed to involve dysfunction in the basal ganglia, a group of structures deep within the brain that are responsible for controlling movement, habit formation, and reward processing. Imbalances in neurotransmitters, particularly dopamine, are also implicated. Excess dopamine activity can lead to an overstimulation of motor pathways, contributing to the involuntary movements and vocalizations that characterize tics. The cortico-striato-thalamo-cortical CSTC circuits, which are neural pathways connecting the cortex, striatum, thalamus, and back to the cortex, are also thought to be involved, with disruptions in these circuits leading to impaired motor control and habit suppression. Understanding how prevalent persistent tic disorder is in the population is key. Epidemiological studies suggest that it's less common than Tourette's syndrome. Estimates vary, but it's thought to affect around 1% of children. Diagnosis typically occurs in childhood or adolescence, and while some individuals may experience remission of tics in adulthood, the disorder is, by definition, considered chronic, lasting for more than a year. It's important to note that these figures are estimates, and the true prevalence may be higher due to underdiagnosis, particularly in mild cases. The signs and symptoms of persistent tic disorder are characterized by the presence of either motor tics or vocal tics, but not both. Motor tics are involuntary movements, which can range from simple actions like eye blinking, shoulder shrugging, or head jerking to more complex actions that involve multiple muscle groups. Vocal tics, on the other hand, are involuntary sounds such as throat clearing, grunting, sniffing, or repeating words or phrases. These tics occur frequently throughout the day, nearly every day for a period of more than a year. Unlike Tourette's syndrome, individuals with persistent tic disorder only experience either motor or vocal tics, but not both concurrently. Diagnosing persistent tic disorder relies on a thorough clinical evaluation by a qualified healthcare professional, such as a neurologist or psychiatrist. There isn't a specific blood test or brain scan that can definitively diagnose the condition. Instead, diagnosis is based on the patient's medical history, a detailed description of the tics, and an observation of the tics during an examination. The diagnostic criteria, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, require that the individual has experienced either motor or vocal tics, but not both, for more than 1 year, with tics occurring nearly every day or intermittently throughout the period. It's also crucial to rule out other potential causes of the tics, such as medication side effects or other neurological conditions. Persistent tic disorder is classified based on whether the predominant symptom is motor tics or vocal tics. Therefore, we have two main subtypes: persistent motor tic disorder, where the individual experiences only motor tics, and persistent vocal tic disorder, where the individual experiences only vocal tics. This distinction helps clinicians tailor treatment strategies to address the specific symptoms that the individual is experiencing. Treatment and management strategies for persistent tic disorder aim to reduce the frequency and severity of tics and improve the individual's overall quality of life. There's no cure for the disorder, but various approaches can help manage the symptoms effectively. Behavioral therapies, such as comprehensive behavioral intervention for tic CBT, are often the first-line treatment. CBT involves habit reversal training, where the individual learns to become aware of their tics and develop competing responses to suppress them. In some cases, medication may be prescribed to help reduce tic severity. Medications commonly used include alpha-adrenergic agonists, such as clonidine and guanfacine, and dopamine-blocking agents, such as risperidone and aripiprazole. However, these medications can have side effects, so it's important to discuss the potential risks and benefits with a doctor. Supportive therapies, such as counseling or support groups, can also be beneficial in helping individuals cope with the social and emotional challenges associated with living with a tic disorder. Currently, there's no known way to prevent persistent tic disorder. Because the exact cause is not fully understood, preventative measures are difficult to establish. However, promoting healthy prenatal care and minimizing exposure to potential environmental risk factors during childhood may be beneficial in reducing the overall risk of neurological conditions. The prognosis for persistent tic disorder varies from person to person. Some individuals may experience a significant reduction in tic severity over time, while others may continue to experience tics throughout their lives. However, with appropriate treatment and management, most individuals with persistent tic disorder can lead fulfilling and productive lives. Research is ongoing to better understand the underlying mechanisms of tic disorders and to develop more effective treatments. Recent advances include studies investigating the role of specific genes in tic disorders and the development of new behavioral therapies. Further research is needed to improve our understanding of persistent tic disorder and to develop more targeted interventions.